Now we want to kind of transition from the world of academia to the real life world of running a school district. And not just any school district, but a really large school district with a lot of students who have some of the conditions that he described at very high rates. And so I'm very pleased to introduce our next speaker, Terry Mazany, the CEO of the Chicago Public Schools. Terry has been a tireless advocate for the health, education, and success of young people, both in his role as the president and CEO of the Chicago Community Trust, and now in his current role as interim CEO of the Chicago Public Schools. We so greatly appreciate his leadership and are very pleased that he's here to share his thoughts with us today.
Good morning, everybody. Wow, gotten stronger and stronger after those two fantastic presentations from Dr. Bosch and Dr. Christopher there. I want to ask us to extend a round of applause for Rochelle for what she's done to make all of this happen. Now, I find myself in a very unusual position. When it comes to a topic like this, I'm the beneficiary of 10 years of work on this and really spearheaded by Ada Mary Guggenheim. Many of you would know of her and her role as the true tireless advocate for a comprehensive coordinated school health model in the Chicago Public Schools. For that. She's fantastic, taught me everything that I needed to know about this to get a start there. And from the year 2000 to just, the first 5 years of the past decade, the trust invested over $1 million in building out this model in collaboration with foundations such as the Michael Reese Health Trust for that. And even I went back through some of my computer files, and there was a document framed as a policy draft for Arnie Duncan to sign that would integrate the 8 components of the Centers for Disease Control model for comprehensive and coordinated school health, and that would include the health education, physical education, health services, nutrition services, counseling, psychological and social services, a healthy school environment, health promotion for staff and parent and community involvement there for that. And a number of these pieces have been developing out. I know that we were starting, again with my hat on at the Trust, the integrated pest management that is now across the public schools, which directly relates to the incidence of asthma in our schools and a way to prevent that work. Great collaborations with the Illinois Caucus for Adolescent Health. The Health and Medicine Policy Research Group have been vital to this. And during this period of time, we've seen very powerful models like the Namaste Charter School for this. And this will now put me on a mini soapbox here because what Namaste Charter School provides is a powerful, innovative model for all of the Chicago public schools, charter and non-charter. And yet we have become polarized as a community of charters versus the traditional schools, which is completely nonsensical. They're all of our children. They're all public schools. Charters play a really important role because of their ability to exist without a lot of the regulations of the standard schools. They can innovate in ways and produce demonstrations for how other schools can be organized. There's a lot to learn. But if we're polarized in opposite camps, there is no communication going back and forth. There's no diffusion of knowledge. We're not learning from ourselves. We become our own worst enemies in this work. We've also seen over the past decade the rise of CLOC, the Consortium to Lower Obesity in Chicago's Children. More than 900 partners strong that has had a demonstrable impact on reducing the rates of obesity in Chicago's children. And much more to go, but we've got the organizational basis for that. And over the past 3 years, in partnership with a massive grant from Atlantic Philanthropies and the leadership of LIST Chicago, creating the Elevate model of community health centers in 5 of our middle schools that have also demonstrated results for children and showed this integrative model for how we can assemble a range of services that Dr. Bosch really laid out very clearly and elegantly, and these causal determinants of health that then give us insight on how do we move down the path to address the broader social issues that Dr. Christopher laid out before us. And then we partner with the Greater Chicago Food Depository, truly a marvel in our community, applying state-of-the-art business know-how to the distribution of millions of pounds of food. I think they're up to over 67 million pounds of food this last year in the heart of the recession to those who need food. They currently serve about 250,000 children under the age of 18. Their program, Nourish for Knowledge, is vital. We have children loading up backpacks on a Friday afternoon to feed their families over the weekend. Children dreading weekends because they would be hungry and can't wait to get to school Monday morning so they can get fed for that. These are the sort of circumstances that we encounter here. But the Greater Chicago Food Depository even pushes beyond that with their Healthy Kids markets, bringing fresh produce into food pantries that are located in our public schools. Our public schools serving now as community centers, addressing a full range of human needs. So it turns out that the Chicago Public Schools is indeed the frontline defense against child hunger. All of this in a context of this nature, how do we be comprehensive and integrative? So as early as 2004, creating snack and beverage standards in our public schools. The Breakfast in the Classroom program that has been wildly embraced across our schools. Yeah, we can have some applause for that. But to recognize that this was not done overnight. This was started in 2008 with a very thoughtful pilot, 200 schools. We were working out a lot of bugs for that. But the issue of childhood hunger is so prevalent. And for those of you, recollect that, was it exactly 2 months ago we had this humongous blizzard in Chicago. And my biggest concern, and also I've got to say, I wish Arnie was here so I could give him a hard time, because here I'm coming into this job and all of a sudden this warning of a great blizzard, and so of course I dash into the Chicago Public Schools playbook on how do you handle a once-in-a-century blizzard. And I discover that the page is gone. There is no page for what do you do for that. Fortunately, I made the right call, and it was actually that Monday morning I had woke up with a dream of a little 5-year-old trying to go through 2 feet of snow in the teeth of a raging gale. And I thought, no, I could not subject anybody to that. We're going to close schools for that. But then it made sense Wednesday, Thursday, but I felt a lot of pressure to reopen schools on Friday. The fundamental reason, so that kids could get fed and get food to take home. So otherwise, they would have been going 5 days without this, and that was too much. And the Chicago Public School staff were incredibly heroic. Getting to their schools, they'd go to fire stations and have the snowmobiles from the fire stations get them into the buildings so they could open them up, get them plowed out, get everything ready to receive students, and we had them all open that Friday. And kids were able to come in and both get refuge, get warmth, get food at that point in time. And so that's the sort of vital connection that we play. And then it's this policy structure. So we do have new school food standards for that. We've also focused on locally grown produce and foods for that, and I think that's consistent with the work that Fresh Taste is doing around that, for that. Of course, we had well-timed with the newspaper the story about recess today, and that's a whole nother story about trade-offs that were made in past years by the adults not looking at the needs of children, and I hope that we're able to address that situation. Last year, we enrolled in the Go for the Gold and launching that. And, you know, we have student chefs from many of our high schools producing extraordinarily innovative food opportunities, menus for our students there for that. So we're pleased to be part of that and developing out this broader environmental action plan, understanding the public schools can either be a major source of the problem for pollution and waste streams, or we can be part of the solution for that. And then finally, the point where we have added health and wellness goals into the school improvement plan, and that goes into effect for this coming school year for that. So all of this is really, I think, a harbinger for the confluence of events that are coming out in the new normal that we find ourselves living in. How do we integrate education, health, and well-being in a manner that is environmentally sustainable? All public institutions need to be about that work. My concerns, however, are what are we really asking our public schools to do? And now on the inside, looking out, I'm really troubled by the fact that we are asking our public schools to solve our nation's poverty problem. We need to be about the business of educating children. And so, yes, every time we add a breakfast in the classroom program with 10 minutes here or there, it does encroach on that. Every time that we have to try to squeeze recess into a short school day, it encroaches on the educational mission for that. And so I need all of us to think about how we can help to address this imbalance there. In that we can't ask the public schools to increasingly solve this public problem of poverty as the federal government is anticipating cutting supports for human services. They'll say, well, we'll let the schools do it. As our state government has cut and will cut more in our human services, we'll let the public schools do it. That is a recipe for disaster. It will create a death spiral for the Chicago public schools by taking us away from our fundamental mission of education for that. And so we have to be very careful about the choices that we are making as a society as we move forward. Fundamentally, even in the best of conditions, we need these partnerships. Partnerships are vital for the Chicago public schools to move forward and to address these circumstances and the challenges that we have, as we do have a dual challenge to resolve for poverty in our country and resolve for education attainment, which is increasingly, more is increasingly asked of our children as we are competing on a global stage for that. But I want to thank all of you for your partnership and your goodwill in supporting our students in the Chicago Public Schools.